yeah, it was really scary because they tell you the things in the hospital, but it's not until you get home and realize just how different they are compared to my first child who was born normally. So it was just a huge difference from a normal age child then whenever they come home. So it's kind of scary whenever you get home and you notice that you don't have all the nurses there helping you anymore. And then since it's twins, like it was overwhelming thinking that I was responsible for these two babies to make sure that they were okay and that just to make sure that they were healthy and that they could continue to develop. But it was really scary. Yeah, actually it was whenever my son Eli, whenever he rolled over for the first time, that's when I realized that the therapy really was working and that it was, I mean, I knew at that point that it was going to be okay. It was a lot easier than I thought it would be. Just whenever because they come to my house, they work with them for an hour, and I have a boy and a girl, and the therapist, the physical therapist comes and the occupational therapist come at the same time, and then they switch off on them. It was a lot easier for me that way. I could get some stuff done that I needed to, and they had both babies, and just how they would work with them and how the babies get excited to see them once they start recognizing them. And it was really nice just having them come over to the home, and I didn't have to take them anywhere, and just the relationship that they build on their own with them was really comforting. I knew that it would be, I could walk out of the room and I wouldn't have to worry about what they were doing with them. I mean, we as parents want to think that we can do everything on our own, but we really can't. I mean, we're not trained professionals that know what to do. We don't. They know what they're doing, and it's just the results you get it's amazing how he did. He started walking further in just an hour. I would say it's not about what you think is going on, it's about what's best for the child, because I was overwhelmed thinking that they were labeling my kids as disabled just because they were born early. But there's no shame in, you know, getting the best care for your kids. Even for me to be able to get a little break and come drop them off, and to know that they have the nurse and they have the therapist here on site, where if something, God forbid, something was to happen, like I know that they're in the best care. You know, that they're in capable hands and they're not going to let anything happen to them. A lot of the times the doctors don't want to make referrals. They're just trying to get you in and out. So you just gotta take that extra minute with the doctor and say, well, is there anything we can do about this? Like, is there steps we can take? And if you get that help for them, they'll do it faster than they would just on your own. Just a group of people that are just trying to help you with your children to make sure they can have the best life and a healthy life, and to make sure that they can just live normally into their potential.